Well, it's been an exciting evening so far, and we thank you for joining us. I'm Molly Hudson. A new COVID subvariant known as XBB.1.5 is now spreading across the country and is now considered the most transmissible subvariant detected in the pandemic so far. I spoke to a local expert who called the situation ahead daunting. So what does this mean for our community? Take a listen.
Most calculations would put it at least 3 times as transmissible. So it spreads 3 times faster and 3 times easier through a population than the original virus.
With the ability to infect people more easily, Dr. James Lawler with UNMC says he is concerned for this new COVID variant.
Our hospitals here are full. Hospitals have actually been boarding patients in the emergency department because they're unable to find beds on the regular wards. And that's before we see this surge of XBB.1.5.
Dr. Lawler says he expects this variant to hit Nebraska by the end of January.
I think we're going to get a lot of cases once XBB.1.5 becomes the predominant virus floating around Nebraska.
Lawler says COVID has plateaued in the community over the last few months, but there is an infrequency of testing.
Our testing rates are as low as they were in May of 2020 in terms of PCR, where we actually get that information.
He says many at-home tests aren't reported and some don't test at all, which means many COVID cases go undetected.
It is probably the case that at least 20 community cases occur for every detected counted case that we have. And the ratio is actually potentially a bit more than that.
Dr. Lawler says it is important now to follow the guidelines we have been hearing since the beginning of the pandemic.
If everybody's wearing a mask indoors, it reduces shedding, so there's less virus floating around in the air, and then it also protects you from inhaling the virus in those environments.
Nationwide, the vaccination rate is low. Lawler says less than 40% of seniors are up to date with the bivalent booster vaccine.
Really, one of the most important factors is just recency of vaccination. The more recently you've been vaccinated, the more effective that vaccine is going to be.
Beyond this new variant, he says we need to be thinking about the variant that comes next.
We need to do much, much better if we're going to protect our communities against a dramatic surge in our hospital system.
Dr. Lawler says he's also keeping an eye on the spread of COVID in China since protocols were recently relaxed there, and he's concerned for the potentially dangerous variants that could come.